2, 3, and then on Friday, I instituted it because people were saying they had clinical on Thursday.
Yes.
So Friday from 1 to 3, they both will be in room 368. Now, hopefully everyone can make that. All right, it's to review exam 3. All right, if you made 75%, less than 75%, you have to review or remediate. So you can come, you do not have to sign up for that, you can come to either section. You will sign in at the section, okay? At the session. So we're good with that? Okay. Also, let's look at your, the calendar here. Some people said they were confused by, it says review session prior to HESI. What that means is you have your final exam here is HESI. This is just kind of more like an information session to go over what's entailed, what the expectations might be. Because there is no concrete method to study for the HESI. I don't have a blueprint for that. So what I want to do is give you some insights about some of the expectations, and I have a little PowerPoint presentation about that. So that's what that's about. It's not a class, it's just a review session, so whoever wants to come can come, all right? And it's gonna be in this room, because I'm doing it on a class day, right? So it's a Wednesday from 12:30 to 2:30. So you should be available. We're just not having class, so it's up to you whether you wanna come or not. If you want to gain some insight into what the HESI might be, some of the insights about it, I will share that with you. Okay? Any questions about that? Okay. And then exam 4 is going to be August 7th, and it's going to consist of these elements. Okay? 20 questions on endocrine, and only diabetes. We're not gonna, you'll get all the other endocrine systems when you get to MedSearch 2. We felt like that would have been, I'm sorry? We felt like that would have been too much, covering all of the endocrine system disease processes. So we're only gonna do diabetes. So I'm only gonna cover diabetes today. And then neuro, so you're gonna have 15 questions on neuro, musculoskeletal. So all 3 of those I need to cover today, all right? And that's why I'm saying we need to get started. And then you'll have your usual 2 math questions. Because we try to keep you in line with math. Because what most students do is it's like farm. You take farm and then you like, I passed that, and then you don't bring it with you throughout the rest of it. So that's why we keep the math going. So math is threaded throughout the entire program. For each course, you should get at least 2 math questions per exam. All right. So that's how that works. Let me do one more thing. Yes. Yeah, just like exam 3. Let me show you one more. Okay. Let me review this blueprint that we give you guys. Okay. So, as you can see, this is from exam 3. So it's a breakdown of the number of questions, and then we look at it in 2 ways, the cognitive type and then the nursing process. You with me? So as you can see, there was only 1 question on knowledge. What do you make of that? Well, it's understanding. If you look over here, the application, that's where you see the most of the questions. And that means that from now on, you're gonna see zeros in knowledge. Because most of your questions would be based on application, wanting you to do something, okay? Or it will be synthesis. In some cases, it might be, analysis, it might be synthesis. So this is to help you understand, if I know I have 16 questions that are application focused on cardiovascular, I'm inclined to say, you know what? I need to really know my cardiovascular, and I want to do questions that are application, that I understand those types of questions, because they want me to take action. Because that's ultimately what NCLEX wants to know, that you as the nurse know what to do in a given situation. So you're not gonna see much of the knowledge. You have to gain the knowledge, understand the knowledge to be able to answer an application question, because without the knowledge, that's not gonna work. Here's what I think that you need when it comes to these nursing questions. 3 things. Number 1 is knowledge. And if you don't have knowledge, forget the other 2. And the other 2 are critical thinking skills and test-taking strategies. So when you apply all 3 of those, your chances of being successful is increased. So, was anyone able to view the video that I posted by a show of hands? 2 people did. 3 people. I posted a test-taking strategy video in Canvas for you to kind of give you some ideas. Now, when I do the review tomorrow and Thursday and Friday, I'm gonna try to do a little bit more of that face-to-face to give you some idea about how to go about answering the nursing question. Nursing tests are not like any other test. You agree? Yes. But you can understand why, okay? Those of you who watched the video, what did you think? Let me ask you, was it helpful? Yes. Okay. So if you haven't looked, you're welcome. If you haven't looked at it, I encourage you to, because it gives you some insight in terms of taking the nursing exams. And it's not just gonna be MedSurg 1, you're gonna get these types of questions throughout the rest of the program in your courses. So you want to start to get comfortable with the type of questions, okay? And I will talk more about that tomorrow and on Friday. So I don't want to spend the majority of my time. Now also, if I break this down into looking at the nursing process, which nursing process is huge. Everything that you do in nursing revolves around the nursing process. You can't take action on something you don't understand. So what does that tell you? You need to assess first. You can't be so quick to want to take action and fix something that you don't have an understanding about when it comes to the knowledge. So the nursing process, I tell my students, everything you do revolves around the nursing process. So understand it first before you try to fix it. And what do you see when we look at the nursing process down here? You got 20 assessment questions. That should tell you something. Do you understand those types of questions? And then 16 for intervention. Do you understand again that application, taking action, is going to be key? And then planning. So I think once you can understand the type of question you have, it makes it helpful for answering. Because if you get a planning question, it means your answer should be based on planning to do something for the patient. You with me? Mm-hmm. Okay. So I want to make sure that it's clear, so you guys can do better on your exam. All right? Any questions about this? Okay, very good. Let's close that out. Close this out. And go back here. Now, let's talk about diabetes. We're going to do diabetes first. Now, let's get that open. Okay, very good. Now, someone tell me, what do you know about diabetes? How many of you have relatives or friends or someone you know has diabetes? I'm surprised that there's not more hands up, because it's a huge problem in our society. It's one of the major problems that we have to deal with. And we're not doing a very good job of it, for many reasons. And it's like trying to understand, why is it that patients who suffer with diabetes can't seem to get past it? What do you think some of the reasons might be? That's huge. Lifestyle changes. They're not good about trying to change their lifestyle. There are people who have diabetes and they have changed their lifestyle for the better, and they're doing fine. And when a patient manages their diabetes, like I said last week, those other problems will dissipate. They no longer have cardiovascular problems. They no longer have kidney problems. They no longer have visual problems, because they are managing their diabetes. And it's great because in today's world, patients can live a long life with diabetes. There was years ago, before many of you were born, people died from diabetes, believe it or not. And with the evolution of healthcare, they can live longer if they just would manage it appropriately. But diet is number one. It's tough getting people to change their diet. They're used to eating but just like they got used to eating what they eat now, they can get used to eating something different that's even better for them. And that's what we want. What else? Anybody else know? What do you know about diabetes before we get into it? I like to know what you know first.
Type 1, type 2.
What's that? There are two types, type 1 and type 2. Which is the worst?
Type 1.
They both have their own areas of concern, but I believe that type 2 is much more difficult to manage than it is with type 1. Type 1 happens to whom? Younger. You know, that's not to say that some adults can't have type 1, but most older people deal with type 2. Okay? So let's look at that. Let's look at diabetes. Pathophysity, the pathophys. So we want to look at the hepatic glucose output. When we talk about diabetes, we're talking about glycogenesis and glycolysis. Okay, so it's that transition, the production. Now, for most of us, it's working fine. The process is working fine. But let's look at type 2. So, type 2 occurs when the pancreas doesn't produce enough insulin and eventually stops all insulin production. So people aren't able to produce insulin to manage their glucose. So as blood rises, the body sends a signal to the pancreas, but guess what? The pancreas is supposed to release the insulin, but if it's not there, it can't do that. So the exact cause is unknown, but this is the process here. So if this is our pancreas and insulin is trying to go and help, it can't get in. It's not there. So glucose builds up in the bloodstream, causing hunger. So what are the three? The three P's? That's right. Poly means what? More. So they're eating a lot, they're peeing a lot, and what's the third one? They're thirsty. So the more they get thirsty, they drink, and that makes them want to go to the restroom. And so those are the three classic symptoms. So you must remember those. The three classic symptoms. So the prevalence, look at this, of diabetes, 25 and it's probably higher than that now, since I put this together. Million adults in the U.S. that's dealing with diabetes. Now let's look at some factors that predisposes a person to diabetes. One of the risk factors is obesity. Okay, and then we talked about type 1, and then of course type 2. So we're going to really get into that insulin resistance part with type 2. And then we also have to look at, when we look at the types, gestational diabetes. What is that? Some moms, when they get pregnant, by the nature of what happens with that pregnancy, hormones and whatever, the patient can develop gestational diabetes. But once they deliver, it goes away. Sometimes, somebody said sometimes. That's true. It may take a while for others, and in some, it may not. But in general, that happens. So again, this is just another visual of looking at type 2 diabetes in the insulin that's trying to get in to help us out. Blood glucose regulation. Blood glucose goes up and down throughout the day for all of us, depending on what we eat, how active we are. All kinds of entities come into play. As your blood glucose rises after a meal, the pancreas releases insulin. Okay? So, here's one thing. When you're teaching your patients, you want to teach them that are diabetic. When they first get up in the morning, what's the first thing they should do?
Check their
They
sugar.
should check that blood sugar. The first thing. Secondly, what should they do? Based on what that blood sugar shows,
Take insulin.
they may have to take their insulin or oral medication. So number one, they've gotta be diligent in checking their blood sugar. Number two, based on what that level shows, and their doctor would have discussed it with them, what the levels are, because everybody's different. It's not gonna be the same for every person. So then based on that, they are to give themselves their insulin or take their oral. And then what do you think the third thing? Eat. Very good. Eat. Because what are we trying to do? We're trying to balance that. Okay? And we gotta look at, just like with us, the fats, the carbs, the proteins. So we're trying to balance all of that. Now I add in a fourth thing. What do you think my fourth thing is?
Check the sugar again.
What's that?
You check it like a
Exercise.
Well, for some patients, they may have to recheck to make sure that it's therapeutic, it's balanced. And then the fifth thing really is what I throw in. They need to pay attention to their feet. They need to pay attention to their feet. That means go in there, you take your shower, your bath, whatever you're gonna do, but you gotta early on look at the feet. Why? What are we concerned about? Neuropathy. Very good. We're concerned about neuropathy because that means they could have a sore, an ulcer, and may not ever know it if they're not looking for it. And time is of essence with that because they need to get attention right away. None of this waiting a week or 2 weeks and thinking it's gonna, if you're diabetic, you better see your doctor soon, within the next 2 or 3 days. Okay? So, don't forget those 5 entities. I could give you a test question on it. I'm just saying. Okay. You're gonna make me do this early. Okay, I'm gonna throw this ball. And whoever catches it.
Well, that's not fair.
Who got the ball? Who has the ball? Somebody has to have the ball.
Hot potato, hot potato. Oh, you got it.
Don't be afraid. Tell this young lady one thing of the 5 that I told you. I'm just asking one. This is my way of I'm making it fun, but I want to evaluate learning. So tell her one. Were you paying attention?
Yes, ma'am.
Throw it back to me. Tell her one thing.
Pay attention to feet due to neuropathy.
Very good. I like that. Give her a hand. Who else? Somebody else tell her. Because she asked me to repeat those 5 things.
Check sugar.
Check your blood sugar.
First thing
Now,
in the
I
morning.
could give you a test question that asks you in order, what's the first thing you're gonna do?
Shake
What's
your
the
sugar.
third thing?
Wake up. Shake your sugar.
That's what I'm talking about. Very good. Give me my ball back. Okay, very good. So you got them?
Take blood sugar.
That tells me how much. That tells me how much. She only had 4. Let's see. Number 1 was
Check sugar.
check your blood sugar.
Take medicine.
Give yourself your insulin. Eat.
Take sugar again.
Recheck. Check your feet. Number 5. Thank you. Moving on. This is a simple slide of kind of like what I just spoke about, so this is a good visual for you, so I put that in. So know this slide in terms of what happens with insulin and diabetes. And this is another comparison of normal glucose patterns. Now, what did your book say the normal range is for blood sugar? 70 to what? 110 or 120? 110. Now, when it comes to testing, I'm gonna use that range because that's what your book says. But know, in reality, that it's different for every patient. It's whatever the doctor tells them they want them to be in, because they look at different entities of that patient to determine where they want their range to be. So you, as a nurse in assessing, if you have a diabetic patient, you have to ask them, what is the range that your physician, your provider gave you to follow? What are you following at home? Okay? So that's what and it could be different. It's gonna be different throughout the day. Ketone metabolism. Pretty much this is important for, I think much more than type 1, looking at ketones. Ketogenesis is the process by which ketone bodies are produced as a result of the fatty acid breakdown in the body, okay? So the consequence of that is ketoacidosis. Now, let's look at this. Hyperglycemia can cause serious long-term problems. What did I talk about earlier? I said if the person manages their diabetes, they can get rid of what? These entities. And then they don't have to have amputation. So if they manage their diabetes okay, they won't have blindness. And diabetes can cause blindness. This should be enough to scare someone to do the right thing. Okay? Cardiovascular, stroke, heart attack. These are serious. So when you're educating, you've got to be, I think you have to be real with the patient. You've got to tell them exactly, be honest but tactfully. So I'm going to tell a patient and try to get them to understand the essence of their disease process. You could lose a limb. If you don't manage your diabetes, if you don't eat right and take your blood sugar and your insulin as you should, you could lose a limb. And that's shocking, but it's true. We see a lot of patients in the hospital who have lost fingers, toes, legs. I mean, and that's, they didn't have to. And that's mind-boggling for some. It would be mind-boggling for me to know that I'm gonna lose a leg. I would be devastated. So, the classics we just went over, right? Now, there are modifiable things that a person can do to help that. You can stop smoking. You can eat right. Watch your cholesterol and the fat. Even though Mickey D's has 2 for 1 doesn't mean you have to go have it. Obesity, watch your weight, walk. Sedentary lifestyle. If that's your job, what could you do if your job requires you sitting all the time? You get breaks, you get lunch, go for a walk. What's that? Someone else said something?
Take flexion of your ankle or something.
Well, you could exercise, yes. If you're sitting, exercise your leg, do something. Just do something. And then control your high blood pressure. I guarantee you a diabetic patient is gonna have hypertension. And all of that is mendable. okay? Now, what we don't find out is some patients can experience other symptoms beyond the classics. Which, if someone is experiencing depression, that could have an effect on their management of their diabetes. So we have to assess for these types of things to make sure that we can address them, okay? Now, this is a great chart to sometimes give your patients. So they can see the comparison of hypo or hyper. Because when you teach them about their diabetes, you want to teach them about both types of symptoms, okay, to monitor. Subjectively, this is now, what did I say, the nursing process has everything to do. So assessing, ask the patient about their past history. Is there anyone in your family that suffered with diabetes? Is diabetes genetic? Yes, it is. Yes, it is. Medication. Are you taking any hormone replacement? Are you taking over-the-counter medications, particularly our elderly? Because sometimes they take so many medications over the counter that can have an effect on their disease process. Ask the patient about endocrine conditions. Do they have thyroid problems? Nutrition. What does that look like? And sometimes you have to ask the patient to do a calorie count, a 24-hour calorie count. So you can, as the nurse, and some of you may go on to become diabetes educators. I think that would be great. And you specialize in diabetes. And you want your patient to understand their nutritional aspect. You ask them to give you a 24-hour calorie printout of what they had in that 24 hours, which will tell you some specifics about their nutrition and managing their diabetes. What is their fluid balance like? Are they drinking water? Or are they just drinking soda and beer and wine? God knows, I know the wine helps, but I have to have a glass or two myself. But I'm not diabetic, and I don't want to be diabetic. I'm not going there. I'm just not going to do it. I will exercise whatever the doctor wants me to do. Okay, so we just talked about the two types. Increased glucose causes osmotic diuresis, so we talked about that. pH decrease in a coma may result, so patient can go into a coma as a result of a poor management of their diabetes. Here again, possible coma, so that's what I'm speaking of, and these are some things that can happen in relation to that. All right, I try to put visuals in because I think they're very helpful in understanding. Lipid levels for adult patients with diabetes. Now, we said 70, this says 100, I need to change that to 110. The book says 99?
That's what I saw.
For what now?
For glucose fasting.
But that's cholesterol.
Yeah, the other ones were.
This is the LDL cholesterol.
Oh,
And that's what I meant, not the glucose. The glucose is 70 to 110. But LDL, we have to look at both which of the two is more important?
Both are important. Both are equally important to each other.
They both are important, but you gotta watch that LDL, okay? And so these are the ranges. Now remember, now I'm gonna say this because I said it last time and I'm gonna keep saying it. I'm still saying it to my seniors. I said it today. cause I teach them from 8 to 12. You gotta learn the labs. The labs, I intentionally put labs on your exam, and people didn't do well. And that was free. Those were free answers, easy. Cause I told you what to study. You gotta learn your labs, guys. You gotta learn these, okay? Cause I'm gonna give you questions on them because you need to start to learn. So by the time you get to Med Search 2 or pediatric, you're gonna know. And you're already peds. Maybe OB did. So, start to learn, these are basic too. And when you go to clinical, and you are looking at your patient information on the computer or chart, you want to start to appreciate, make connections about that patient in their labs. Don't just jot it down because you got to turn it in on your care plan. I know that's what you do. Because I used to do it. As a nursing student. But it's important to learn how to make the connection, and it's so wonderful when you can appreciate the labs and all of that information in terms of where your patient is. And you can say, you know what? We studied that in the classroom, and it's relevant and it makes sense to where this patient is. Okay? So, make sure, now don't try to, you will try to memorize, but eventually I want you to learn them, so you know them when you see them, okay? Type 2 diabetes prevention and treatment, lifestyle modifications, exercise. Now, how do you think, I could give you a test question on what would be the best way to get a patient that has diabetes to exercise?
Give me
Ask
the
them,
list.
by asking them what
Do
they
you-
like to do.
That's right.
Yeah, you gotta include.
Ask them, what is it that you like to do? You are involving them. Don't go tell them, I want you to walk 2 miles a day, because that's probably not gonna happen. But let's start them off light and see what they like to do now. And incorporate that into trying to make that change when you do your care plan. When you do care plans, don't just write the stuff from the book. It has to make sense to your patient. And that's where, I know you're learning, but that's where I say, oh my God, it's so easy. Because I can only develop a care plan that's reflective of my patient. I'm not gonna say my patient's gonna walk around the nurse's station 5 times if they're 79 years old. That's, your instructor's gonna say, come, the patient is barely getting around now. They're doing this, and you say they're gonna walk 5 times around. Come on, be real. That's not gonna happen. I'm not gonna do it. If I'm your patient, what can they do? So make it conducive to what is appropriate, specific to your patient. Don't just write that stuff down that's in the book.